Yes, welcome. Welcome to the fourth of a series of 5 university dialogues sponsored by the School of Nursing in celebration of its 40th year at APU. Yay, 40th. Yay, woo, okay. One way the School of Nursing is observing its anniversary is to offer these opportunities for faculty members of different schools to engage each other on issues relevant to healthcare and relevant to broader university interests. And in particular with a view to deepening the sense of APU's strengths to pursue its mission. Wow, that's pretty valid. Okay. Today's topic is interdisciplinary healthcare, the challenge to APU. It was very interesting to me as I had some preliminary conversations with our 3 speakers that each one independently voiced the opinion that interdisciplinary healthcare is in fact the future of healthcare. And that also it was interesting to me that each one also said, nevertheless, I don't want to talk about broad abstract issues. I want to be a part of a conversation that addresses education at APU. And so that sets the parameters for our talk today. Renee Pozza, Ph.D. and registered nurse, Associate Dean of Academic Affairs, represents the School of Nursing. She is a researcher interested especially in the treatment and effects of treatment for patients with hepatitis C. Recently, Renee has become a fellow, invited to be a fellow of the American Society of Liver Disease. She is the second nurse to become a member of that organization, which is otherwise full of MDs. Mary Rawlings, Ph.D. and licensed clinical social worker, represents the social work department. She's chair and MSW program director in Bass. Her research and writing focuses on interest in competency-based education, assessing outcomes of social work education and experiential learning models, such as service learning that can enhance student educational outcomes. And then Susan Shore, Ph.D. and chair of Bass's Department of Physical Therapy and licensed physical therapist. Her research interests include the evaluation of adaptive equipment and provisional of services for the disabled in the developing world. She also serves as chair of APU's Doctoral Studies Council and also oversees the fastest growing doctoral program, I think that's correct, at APU, and the Doctor of Physical Therapy. So we have people who are quite involved at various levels of their discipline. I like to comment and set the context of, in this anniversary year, I like to hark back to Florence Nightingale if possible. And certainly in her efforts in the role of nursing, Florence Nightingale was very aware of the social, of the political, of the intellectual context for health and for nursing. Even to the point of engaging political and social leaders, even haranguing them in her particular urgency to establish nursing on its proper foundation. But she also connected with those in other disciplines relevant to nursing. At 38 years old, she became the first woman admitted to the membership of the Royal Statistical Society. And in the same year, she submitted 2 papers to the inaugural Congress of the British Association for the Promotion of Social Science, and was regularly a contributor of papers to that society. Such was her interest in disciplinary engagement and commitment. And so we, in our particular moment of urgency in this matter, perhaps might be encouraged by Florence Nightingale's words, and I quote, "So never lose an opportunity of urging a practical beginning, however small. For it is wonderful how often in such matters the mustard seed germinates and roots itself." Please welcome our speakers.
He's a little taller than I am, huh? Thank you so much for attending, coming on this Monday after Super Bowl. Everyone enjoy your day yesterday? Depends which side you were on, right? Well, we certainly thank you for coming and have really enjoyed, I think I can speak for Mary and Susan, our interactions as we have been meeting together several times to put today's kind of talk. And in the spirit of interdisciplinary and collaborative, we would like this talk to be very collaborative. So we are not going to follow I'm going to speak, and then Mary's going to speak, and then Susan's going to speak. We're going to try and interject back and forth. So we may at one point be all three up here at the mic, so just bear with us. But we do want this to really speak to what are some of the best practices, what's the environment that we're in now, and then look at what are some of the issues we face here at APU and what are some of our challenges and opportunities then moving forward for interprofessional education as well as healthcare. You know, many of you know that we're in this environment, and interprofessional education is not new, but we certainly are seeing more and more impetus for the importance of this, driven by healthcare reform, patient-centered care. And so really, if you look at the definition of interprofessional education, it occurs when two or more professions learn with, from, and about each other to improve collaboration and the quality of care. So ultimately, what we're talking about today is how can we as healthcare providers, whatever discipline that we approach this from, but ultimately, how are we impacting quality of care, the health and the safety of our patients, the communities, the populations that we serve. So it might be something at an individual level, and certainly you'll see we are also talking about impacting populations of health and certainly global health. So as we were doing some literature searching in preparation for this, we found models that are used here in the U.S., but also models of care globally. In fact, one of the instances, I'm going to start with a story where I saw collaboration and a practice setting the best was when I was taking a group of students to Brazil recently, and Dr. Lynn Woods and myself were down there, and we were looking at geriatric patients, and so they were collaborating as a team in their approach to geriatric care. And so each patient, the patient and family would come in, and in this healthcare setting in Rio, they were seen by each of the disciplines. They had an hour with nursing, they had an hour with medicine, they had an hour with physical therapy, they had an hour with OT, they had social work. And then the disciplines would all come together once a week and have case presentations. And it wasn't presented by, there wasn't like one person that was in charge of the whole thing. It was a very collaborative, fluid, these are our recommendations from our perspectives, and here, let me listen to what your perspectives are. And then they would come as a group then and make decisions about this is the best medicine to use for this patient, these are some of the home adjustments we need to make, these are some of the family issues that are going on. And then things were updated that collaboratively on a continuous basis. And it was amazing to me. Now, yes, that's resource intensive, time intensive, but what quality care was that patient and that family given by having that kind of experience, and those professionals looking over you, right, and making really coordinated decisions. So when we look at this issue, how are we educating the next generation here at APU to participate in team-based, collaborative healthcare relationships like this, ultimately for the care of the patients and the families and the populations that we serve? So I mentioned briefly we have the healthcare reform, 2010, and that certainly brought us into more patients having access to care, more patients are insured here in the U.S., as well as some challenges with how are we going to do this. It's certainly stretching our primary care physicians. We probably don't have enough of them. We're seeing increased use of nurse practitioners in the workforce, and what are some of the challenges and the opportunities as we have more and more nurse practitioners in the workforce providing some of this care. And then certainly we've seen documents that are influencing the value and the importance of interprofessional education. So on your tables, we gave you a document. These are just a summary. that's coming out of a collaborative effort. These were published in 2011. It's an expert panel that called for the core competencies for interprofessional collaborative practice. So this is US-based, and you certainly can find different competencies. I found some from Australia, there's from Canadian, the UK has some, Sweden has some best practices, so we're not the only ones globally that are working on this, but certainly it has been signed off by many of our organizations here in the US. So this is coming out of the American Association of the Colleges of Nursing, the Osteopathic Medicine, Colleges of Pharmacy, the Dental Association, the medical colleges, and the schools of public health. And since these were published, more and more associations have also are adopting these core competencies. So they're really looking at what are the, and I'm not going to go through each of them, but what are the competencies for an interprofessional collaborative practitioner. So we look at values and ethics for interprofessional practice. Then the competency domain 2 highlights roles and responsibilities. And much of what we'll talk about is the understanding what your profession does, but what do the other professions do? And where do we have overlap? And where can we challenge each other's thinking and benefit from each other's thinking related to that? Then the third one is interprofessional communication, and the final one is teams and teamwork. So really it challenges us from many perspectives to thinking about how are we educating within our own disciplines to work in these teams that will ultimately provide care. So what we're going to do in the next few minutes, and we certainly want time for dialogue because I can see there's lots of disciplines here in the room, and I'm sure you're going to have some questions for us, as well as we'd like to spend the majority of our time talking about, okay, this is what it looks like for others, but what does it look like for us here, recognizing that we have some of the health professions disciplines on campus, and we are also not educating a few of them here. So maybe we need to talk about, can we collaborate cross-institution with other universities that are offering this, so we have the complete component of what we need in healthcare. So we're going to talk a little bit, the three of us, about what are some of our unique program specific requirements. Many of us thought of immediately all of our accreditations. You know, we are under tight rules and regs, both by the state and national associations, as well as all three of us will speak to our impacted curriculums, and we value every minute that we have. And then also challenges, we're all practice-based professions, and so you'll hear us talking about placements and our partnerships with healthcare agencies and how important those have become. Then we'll spend a little bit, we each have some ideas of some models of interprofessional education, what are some best practices out there, and then we'll talk and move into what are the challenges here for us at APU, and we've thought of, we think, some very practical solutions that we could make some next steps with, as well as long-term goals that we would like to see us here move to here at APU. So in nursing, I'll just give you, many of you out here are my colleagues in the nursing, School of Nursing. So we are educating people in our School of Nursing, and I sent us an email this morning. I don't know if we can announce, but the U.S. News and World Report, USA Today, we are, number 8 as far as the schools of nursing across the nation. So, yay! So we are making significant impact in the nursing profession and our ability to educate. But that also means we've been challenged with growth, expansion. We're operating on multiple regional centers, campuses. We are educating our traditional bachelors. We have entry-level masters. We have our nurse practitioner program, and Bonnie will speak to the numbers that that program has had significant expansion and enrollment challenges. And then we have our doctoral programs, both the clinical doctorate, the practice, so the DNP, as well as our Ph.D. program. So even within our profession, we have these layers of education, and we still are challenged with what's our entry level to practice, right? The IOM report in 2011 for reform for nursing education called for bachelor's to be the entry-level practice. And for those of you that are in the room remembering, we've been talking about this in nursing for a long time, because there are still community colleges that as an RN, a basic level RN, that's your entry to practice. So we're certainly making headways towards that. There's data out that shows if you're cared by a nurse that's been prepared at the baccalaureate level, you're more likely to have better patient outcomes. And so those of us that are working in institutions of higher education, that's important for us. And we're trying to seamlessly transition those nurses that have been educated at the ADA and ADN level into bachelor's and above programs. It's been just the last 10 years in nursing that we've had our doctorate in nursing practice. And that's made us ask questions of how does this new role, or is it a new role? How does this translating into better outcomes for patients? Where is this role best used? And what's the curriculum that should look like? How is this different than a Ph.D.? Many of us get asked questions by students all the time. Do I do a DNP or do I do a Ph.D.? What's the difference? So even within our professions, and I'm sure you guys are going to tell us some of the challenges that you have and are facing within your own discipline specific. Last comment, and then I'll turn it over to my colleagues here, is accreditation and some of the state issues that we face. So national licensing, state licensing, all of the, and we have both the state's going to come and the national accrediting within the next year and a half here in the School of Nursing for us. And so we're acutely aware of some of these rules and regs and the standards that we need to meet. But, that provides challenges and also opportunities there as we look at how do we meet some of our own discipline standards while wanting to incorporate more interdisciplinary education and practice. With that, I will turn it over to Susan.
Thank you, Renee, for setting us up there. So I'm just going to be representing physical therapy and our association, our creditors. In 2014, August 2014, the American Physical Therapy Association also endorsed these interprofessional education collaborative core competencies that you have at your table. So they released a position statement saying we do encourage interprofessional education, collaborative practice, we endorse these competencies, and our members will endeavor to integrate these core competencies into their practice and education where feasible. That was a clear position statement, and of course, as soon as the association makes a position statement, then the accreditors go, oh, well, let's put that in writing as well. And so we now have it as well for the physical therapy education curriculum standard 6F, new, which says the didactic and clinical curriculum includes interprofessional education. Learning activities are directed toward the development of interprofessional competencies as listed. This criterion becomes effective January 1st, 2018. So, and they say, we will know that you are abiding by this standard if you describe the learning activities that involve students, faculty, and/or practitioners from other healthcare professions, and describe the effectiveness of these learning activities in preparing students for team-based collaborative care. So, we now have a standard that we must measure up to. APU's DPT program has 2 years to get this up and running, so January 1st, 2018, for us to be able to defend the practice of interprofessional education. So that's where we are as APU's DPT program. We're beginning within our program to talk about these things because we have to. And so this spring we've just begun a new cohort. Actually today is their first day. 48 new students running around Mary Hill trying to find where things go. But one of their early classes this spring will be a time at Casa Colina. It's a course on professional interdisciplinary communication. So they'll be there interviewing patients, and part of that experience this time is going to be to bring in various professions that deal with these patients and have the profession say, hello, I'm an occupational therapist, this is what I'm doing with that patient. Hello, I'm a pharmacist, this is what I'm doing, and so forth. So we have begun that process, but we have 2 years to prove that we do it well. So that's from the physical therapy. I'll turn it over to Mary for social work.
Hi, welcome everyone. First, I also really want to thank you for inviting social work to the conversation. I think social work is an important part of the team, and not only in direct practice healthcare settings, but I think this conversation of interprofessional practice applies across other departments as well. I think about criminal justice and social workers and nurses interacting with policemen or educators or teachers. That really team-based approach to well-being is even a bigger conversation than just healthcare. I think healthcare is sort of driving that, as Renee was talking about with the Affordable Care Act and the reforms to healthcare education. It really is, or healthcare delivery, it's no longer an option. We are looking at integrated care models where we're really integrating behavioral health and physical health, and we need to prepare our students to work effectively in these settings. I think the landscape really has changed. And as Renee said, research really indicates that when teams work well together, they have better patient outcomes and better patient satisfaction. But from a social work perspective, we're also looking at policy implications, and one of the primary goals of the policy was cost effectiveness, right? Really trying to also be more efficient in how we're serving our clients. But I think there's also professional benefits. Professions who, people who work on teams that are working well have better work satisfaction. They feel better going to work and have improved sort of their own personal well-being, being able to work effectively in those models. So in social work, similar to the other professions, they have signed off on and endorsed the IPE competencies that you guys have on your table. And they just approved their new educational policy and accreditation standards in 2015. And while it is not as strictly mandated as in physical therapy, it is absolutely infused across the new expectations for social work competence. So social work now has 10 competency areas, and I think in about 4 or 5 of them, interprofessional competence and skills were referenced. So for example, our first competency is demonstrate professional and ethical behavior, and specifically listed under there is understands the role of the other professionals while engaged in interprofessional teams. Interprofessional competence is also described in areas of client engagement, assessment, and intervention. For example, specific points are value knowledge and skills of other professions and communicate effectively within interprofessional teams. Now, I think it's not clear yet how specifically we'll be assessed on that outcome. These are new standards. So it is unclear if our accrediting agency will come in and say, show me specifically where you are doing this. They've changed their assessment model where more freedom is given to the schools themselves and how they are going to design their assessment measures and outcomes. However, I think regardless, we need to do this not just because our accrediting body says we have to. I think we need to do it because we need to really effectively prepare our social work students and our nursing students, our PT students, to really be quality practitioners once they leave our program. So I think we can say, well, we have to do it, so now we'll put money towards it. I think I also want to argue that we need to be having this conversation, and it's a timely conversation because it is the ethically correct thing to do, I think, at this point in time to really graduate the best students that we can from APU. I now get to transition us into some models of interprofessional education. And we're going to present 3 different models to you. I'm going to talk a little bit about the use of simulation, and then my colleagues will talk about case conferencing models as well as interdisciplinary coursework or curriculum models. And one of the most common emerging approaches to interprofessional education is to bring different healthcare profession students together in a simulated practice experience that's designed to give students an opportunity to practice in an interdisciplinary way. So now simulation has been a long-standing approach to healthcare training, often using mannequins for students to practice live and demonstrate their skills, or using standardized patients, which is a trained actor or actress that's trained to play the role of a client in a specific scenario. So in IPE, a case scenario is presented to a group of students. For example, on our campus, it might be nursing, PT, and social work, that's specifically designed to create maybe triggers or opportunities that the different professions need to interact around the care and planning, treatment planning of a particular client. So for example, similar to the actual cases Renee was talking about, you might have a geriatric client that comes to the hospital who's broken their hip. Okay, so they need medical care, will also need physical therapy intervention and follow-up, but maybe is having relational issues at home or cannot be well cared for back in the home, that you might also need to bring in a social worker. So the goal of these simulations is not for each individual profession to show off their skills. The goal is to really design a scenario that they have to engage each other in the demonstration of these interprofessional competencies. So the interaction occurs while being observed often by peers or by their professors, and then is followed with a debriefing exercise post the simulation encounter. So really they get the chance to talk with each other to say, okay, what did we do well? Where did communication break down? What could we have done better? And what did we learn as a result of engaging in this case scenario or this simulated experience? Now, there's been quite a few articles that have been put out that have talked about how do students like these experiences. So the research is really clear that students really respond positively to these experiences. They feel like they learned a lot. They feel like they learned about their role on an interdisciplinary team. And they say they find it very valuable in terms of their own professional growth and learning. I think more research is needed, however, to see if this actually impacts patient care out in the hospital setting. I think that's really the next layer of research. I was just at a simulation conference, and they said, don't even submit anything on student satisfaction with simulation. At this point, we know students like it. They know they learn from it. What's the impact of that on actual practice once you go into the healthcare setting? I think we are talking about this at, I think across the country, simulation is a hot topic. They're building, a lot of universities are investing in really sophisticated simulation centers. I get excited about talking about a sophisticated simulation center here at APU. Really contributing to that next level of research, like how does this translate in practice? But hospitals are also talking about this, because they're also having to train their teams to work in an interprofessional manner. I think it's a challenge. I know in our profession, and I'm sure in the other professions, we train our students and then they have to go into a healthcare setting that has long-standing cultures, right? So how do we help then our students even prepare to work in cultures that may be really still steeped in hierarchy in terms of who's in charge at hospitals and how to really find their voice. There also are specific programs available. Team Steps, which many of the nurses may be familiar with, is a already designed simulation experience for developing interprofessional teams that is often implemented at hospitals, and then also some schools are starting to use Team Steps approaches as well. But that model is really, I think, specifically designed to address communication within the hierarchy at hospitals and training nurses, social workers, how to challenge situations where maybe patient safety is at risk, and really in order to really have better patient safety outcomes. But I think there's models out there, and it's exciting for us to think about, I think, using simulation. So I'll turn it over to Susan.
Good. So I was going to, I thought I was going to be able to show you here on the screen some open access cases. There are many cases that exist already for interprofessional education. University of Western Ontario in Canada, on their website, you can just look at interprofessional education cases, right? And there are 20 cases, so start with those cases. And listed on their website also per case are certain icons. So you can look on the website and say, look for the right icon, because let's say you have 4 professions that you want to interact about or around. So you just click on the right icon. For example, I don't know, psychology got they have the brain icon, PT's got the crutches. So I don't, so you look at exactly, that's what I'm thinking. So you look at the icons, you choose a case that has the right number of icons for all of you, and then click on the case, and it will list the entire case, medical history, presentation, etc. And then you begin the discussion. It has a facilitator's guide. So cases typically are facilitated by faculty, and so that is something to think about in terms of our barriers or the direction that we go in terms of APU. We know that involves resources. For us, we have to contribute resources, faculty, et cetera, to help facilitate these things. And I know, for example, Western has this interprofessional education, which is all these courses are cross-listed, and they have interprofessional education is outside of the school, so it's not within any particular school. So back to the cases, there are lots of open access cases. Creighton has videos online that you can look at. Worst case scenario, team conference, best case scenario, team conference, how they communicate. And so the faculty facilitator can then talk about that. What did they do wrong? What could they have done better? What would you do? And so forth. So the cases particularly are made, as Mary was mentioning, to help students learn what is their practice act, what are they allowed to do legally, and what are the other ones? What do they do? Oh, you do that? Oh, you do that. So where are the lines and where do we cross over, as you were saying? Can be given, often is given, so students all have the case ahead of time. Students have time to go look online at their practice act to see what they would do, how they would interact about this particular patient, and then they would come. The facilitator would say, so let's go around. So let's talk about what you would do. What would your profession do for this patient? And what can't you do? And who do you need in this room that you cannot do? To learn how what you do impacts the other profession and so forth. So discussing communication cases, discussing ethics cases. So who is responsible for what? I was watching a video, one of the worst case scenarios. So a team conference where they were going around talking about this particular patient and what they'd done. And time and again, people would say, this patient is complaining of, I don't remember which pain, TMJ pain or something. Someone really needs to take care of that. Next one, on and on. So yeah, he's complaining a lot of pain. Someone needs to look into that and so on. So we, as a group, we talk about, yep, somebody needs to take care of that. Who's taking care of it? And so let's come up with a plan, a team-based plan with the priorities. So everybody said pain, so let's put that at the top of the list, and who's delegated to deal with that, those kind of things. So one of the things that's used as a methodology is case studies for interprofessional education. I'll turn it back over to Renee.
Just briefly wanted to mention the idea of the curriculum redesign and courses, and many institutions in trying to meet some of these goals of interprofessional education have looked at what are some core courses that we could take together across disciplines, also as well as what are some of the courses and content that are that work well for interdisciplinary educators and faculty. And what I kind of gleaned from the literature is it can't be just an add-on to your existing curriculum, or that it's an elective option. But universities that have done this well have really looked at this from across the university setting and really kind of blew up their curriculum and designed new courses, made it part of their mandatory curriculum. And in doing that, they realized they needed a lot of faculty development. Many of us have been educated in a profession where we were given a professional identity from the beginning. And you almost were, this is my professional identity and this is my turf that I have to defend. And we do operate in these silos, right, and become a little territorial. And many of us as faculty, that's what we were brought up in. And so we're going to teach the way we were taught. And so this is really looking at how do we develop the next generation of faculty that can really teach cross disciplines and work on some of this curriculum design. So some of the issues to consider are who are going to be your participants, and this kind of bleeds into some of our challenges here. But we're talking about a doctorate of physical therapy, undergrad and nursing students, undergrad social work students. When you're dealing cross levels, what are the levels of participants? One of the challenges that I read was, do you want to introduce this early on? And some people say it should be right at the beginning of your course. The very first freshman student should be in interdisciplinary curriculum and courses like this. The other side of the argument is, no, you need to develop their own professional identity first, and then you put them in this team approach. And so, and I'll tell you, the literature can argue on both sides of that coin. So, those are challenges as you're trying to design, like, would this look like, APU. The delivery, do we want an online modality? Do we want a face-to-face? Do we want a clinical practice? Just think of if you put all three of us, right, in the clinical settings together, how rich that environment and that experience could be. However, you can also, I see the placement team in here thinking of all the challenges that's going to raise with that. So the approach. Other models within curriculum have found that international experiences and service learning experiences are extremely effective. And I think we do that well here at APU. So maybe that's an area where we start with or certainly look at. And then assessment and evaluation. So like Mary said, how are we not only saying are the students satisfied because they're in with other disciplines and being taught by a multidisciplinary faculty, but what are the outcomes? How are we impacting and how do we evaluate that? What do we even measure? So those are all issues that when you're looking at curriculum and course design. Now I'm going to turn it over to Mary because I started on some of our challenges here at APU, and I'll let Mary finish.
So yeah, I'll just build a little bit more on what Renee had to say, because I think we really wanted to focus on solutions. Like when we were sitting around as a team talking about this, we really could easily list the challenges, but we really force ourselves to take a lot of time to go, what are solutions? How are we really going to move this agenda forward? So the other thing is, as we sat around and listed all our challenges to APU, I think these challenges are not unique to us. These are challenges that I think are facing schools across the country that are trying to move ahead in developing interprofessional education. So first at the department level, and several of us have mentioned this already, where do you put this in already impacted curriculums? I know CSWE feels like every time they come out with new curriculum, more needs to be squeezed into the same amount of time. So our curriculums are already impacted. I think another challenge is when not everyone on your faculty is committed to interprofessional education. I think not everybody is bought into this idea. What we've always done has worked, and why do we need to change? And then it's hard to change curriculum. I don't know about your departments, but within my department, it's a big effort to really, we now have mapped out where we're doing our competencies, and it's all aligned with accreditation, and how do you really implement that not as an add-on, but in an integrated way. Scheduling is the #1 challenge that seems to face universities across the country, and that is here as well, right? So if I want to try to do something, we just started talking about, well, when are your clinicals? When are your students in field? How long are your semesters? My students are in the field, Tuesday, Thursday, or Monday, Wednesday, but my undergrads are in the field, Monday, Wednesday, just as all over the place in terms of trying to figure out when is a time that we could actually even get our students together and then get faculty together to actually be there to provide structure, input, and oversight. And then space. Space was a huge challenge here, and really, you know, if we were to do simulation, where would we do that in a space that really could facilitate that learning environment? Or the nursing program has campuses all across Southern California. How do you bring students to a central space, or do you bring other professions up to those other regional centers? So there's, I think, space and logistical challenges. There's student factors, like I think we already talked about, differing levels of experience. Do you put bachelor's level social work students with nurse practitioners, right? There are different levels of experience. Or do you put bachelor's level students with bachelor's level nursing students? But then how do we bring in a PT student? So the level of students and level of experience really varies. And even in social work, we have some students that work in hospital healthcare settings, but we have a lot of students who don't work in hospital healthcare settings, but work more, say, in criminal justice settings or child welfare settings. I think also more of our programs, we have a lot of non-traditional students their lives themselves are impacted. So for us to ask, you know, to say, come to campus one more time for this other learning experience is a challenge for them when they're already balancing really busy lives and a lot of responsibilities. Another challenge is the lack of resources or workload allocations that Renee already alluded to. It takes time and money, and I think it's an investment, and it takes a commitment from the university, and I think deans and provosts, glad we have a couple of those in the room, to really go, what resources are we willing to give to this? Because I think it's hard as departments to go, we need to do more with the same amount of resources. People are already working, I know in my department, and I know this is true in PT and nursing, really hard. So to add one more thing to faculty's plate, we have to figure out a way to either give workload units, course release, something to, I think even financial innovation money to really be able to move the agenda forward. And I think at APU, as Sharon mentioned, we are limited in the number of professions. We don't have a school of medicine here or a pharmacy school, key members of the team. So what would it look like to just use our own students that we have here, which I think we could and they would learn a lot, but there's other disciplines then that they're not hearing from. So how do you sort of integrate those things? So those are a few of the challenges, and I'm really excited to talk about the opportunities.
Okay, in closing, I say all three of us come up here because this certainly was brain power from the three of us together. So we really feel that this is no longer optional for APU. This is not something that we can talk about. I think healthcare has moved in this direction. Other universities have moved in this direction. You can see accreditation has moved in this direction. We will be asked how we're doing this at APU. And so now we need to figure this out. So we really challenge APU to develop an interdisciplinary task force that looks at some of the challenges that we have here, but also where are some of the solutions? How can we partner with other institutions that have done this well? How can we partner with other institutions that have complementary disciplines to make a full healthcare team, if that's the direction we're going to go with interprofessional education? How are we going to do faculty development? And look at some of that. So I think if we put together, even when we were talking, we could see like, oh, you know, we could do that simulation. And I know our simulation, director of simulations already reached out to the undergrad social work department, and they're starting work on a domestic violence scenario that they're going to do together collaboratively. I happen to be sitting next to some of the PT faculty at an app training, the teaching learning workshop, and they were talking about they have to do more health promotion and wellness and nutrition in their curriculum. I thought, well, we do that in nursing. So already just by putting us in the room, we have these ideas. So I think if we, structured that a little bit more formally and, put some resources behind it, I think that we could come up with some real creative solutions to how to make this work. You guys want to?
Actually, you said it well, I think. I think the most important thing is that we as a university will be committed to this and are willing to discuss how to make it work. Obviously, it's not an option for us. We have to figure it out. And so how to make that happen is the question. We have good minds here. We have people who are experienced clinicians. We can think these things. We can work it out. We can.
I guess I want to just end on some practical things that I think I've seen. There are schools that are doing it well, have done. I think the schools that I've sort of heard that are doing this well, they kind of had a mandate from their dean and provost and said, you must do this, to really push them through the barriers. And we're going to give you this money and this time and this resources to do it. So really, there was a lot of support from higher administration in moving the agenda forward. I think another creative thing that I've seen at several universities is that there was set aside time in the curriculum as agreed upon by the different, during the academic year that was set aside for interprofessional training and experience. And I thought a really creative idea was 3 times during a semester, there was just some nights that were held open where no classes were scheduled to have the chance for the students and faculty to be able to get together. And in the first meeting, the different disciplines just talked about their roles and then what they do. In the second meeting, they worked on a case scenario together where they were in teams with each other. And the third night, they actually got to engage in some interprofessional simulation, which I thought really was a creative, sort of blended all those ideas together. And they did it once a year, so not every semester. But I thought, that we have to look at our own resources, and we have to do analysis of what we have to offer here at our university. But I really think there are creative solutions. I've really enjoyed being part of an interprofessional research team with our SBIRT grant. Again, I think you get us all in the room. We're all in our own programs. And even though we're in the same school, I'm on this campus, Sharon's on the other campus. We're not in the room together a lot just to really have an intentional conversation. And it's been fun to be in this interprofessional research team where you really start learning what each of us brings to the table, even in designing research. And I know I've seen some calls out related to research in this area, as well as scholarship opportunities for our students that are going to be engaged in integrated care. I know we had to pass an opportunity last year. We just didn't have time during accreditation to write for that. But really a collaborative effort of schools to be able then to even get scholarships for students. So I think there's lots of creative ways for us to move this agenda forward.
Now I think, one comment, and then I'm going to open it up for questions, but I think the three of us were talking about how we really feel very collaborative, and I think one of the strengths here at APU is that we can work together and figure this out, with our motto being God first, and ultimately it's for the care of who we're serving. And so we really all have servant hearts, and I think some of the challenges that other universities have had, I would hope that we will not have those challenges here. So,
well, let me express my thank you to all three of you for this dialogue. Great job. I think this is really cutting edge, and yet at the same time we know in some ways we're reinventing this again. And I was looking at Anna in 1979. We started a project with high-risk infants, which was a fully integrated multidisciplinary model where everybody had an equal place at the table who'd follow babies in the home. And somehow, it takes maybe 20, 30 years to reinvent this again, but I think this is where patient care is at. This is truly where we are able to provide the level of care and change patient outcomes, is when we all work together and not and communicate together. And so this is really admirable. I also want to just say that in 2003, when we did the doctoral study, there was a section in there, I'm going to resurrect that again and send it to Mark Stanton, in which we strongly recommended interdisciplinary coursework. And here we are 13 years later, it's not happened. It's a challenging piece, but it sounds like the time is right to remind them that this has been a long commitment for APU. So thank you so much, and as members of our team, we look forward to working very closely together with you. Thank you.